So thank you everybody for joining us today. My name is Megan Butler with the Liftoff PGH team, and we are really excited to have a really special session for you today. We are going to be highlighting 4 teams from the semifinal round of the Liftoff PGH Ideathon Pitch competition. So to give you a little bit more information about the Ideathon Pitch competition, it's a pitch competition that we launched as a part of the overall Liftoff PGH Summit earlier this year, with a goal to help highlight young people and students in the Pittsburgh region who have big picture ideas for ways that we could help improve the healthcare system. And we received ideas from all across the healthcare system, all different types of ideas. And those ideas moved on to the semifinal round. And then we have 3 finalist teams who are going to be pitching live at Liftoff PGH on December 15th. So we hope that everybody in the audience today will join us for the final round of pitches on the 15th. But for today, we have a really special treat because we wanted to highlight a few of the semifinalist teams who, although they didn't make it to the final round, we were really blown away by their idea. We really wanted to give them a platform to share their ideas with the greater Pittsburgh healthcare community and the greater entrepreneurship and life science community. So thank you again, everybody, for joining today. We know you'll really enjoy hearing from some of these young folks here in Pittsburgh who have some really great ideas for solving healthcare. We will also have time at the end for some interactive Q&A. So if you have any questions that you think of as you're hearing the pitches, please feel free to either type them in the chat or in the Q&A module. We will wait until the very end to answer all of them, but feel free to type them in whenever you want so that you don't forget. So without further ado, let's go ahead and get started. So I am going to introduce the first team, who is Noma Ai.
All right, thank you, Megan. I'm going to get set up really quickly here. Share screen. All right, you guys can all see that? Great. All right. So we did the sound check, so I also believe everyone can hear me. So I'm gonna go ahead and get started. Slide advancing is not occurring. All right. So I'm going to start today by telling you all a story about a pregnant mother who came into a Pittsburgh hospital with a normal, low-risk delivery. After her delivery, this mother started to hemorrhage or bleed excessively. Unfortunately, the hospital didn't have enough blood on hand for her, and she needed to be transported to a more well-equipped hospital. When she got to McGee Women's Hospital, there was nothing the clinicians could do. She had lost too much blood too quickly. I'm Michelle Presley, the VP of Women's Health Innovation at Noma Ai, and I've dedicated the last 4 years of my life working to find the solution that I'll share with you today. So during pregnancy, the blood flow rate to the uterus is around 1 liter per minute. With a total blood volume of 5 liters, if a hemorrhage happens, time is of the essence, and a mother could bleed out in minutes. This larger loss of blood during childbirth can lead to a higher risk of needing blood transfusion, increased length of stay in the hospital, chronic anemia, a loss of the uterus, and potential for future children, and like the case I just told you about, can even lead to death. To understand the scope of this problem, I'm going to cover a few statistics. First of all, it's unacceptable that 1 in 20 mothers in the United States experience hemorrhage. You may also be surprised that the overall maternal mortality rate in the United States has more than doubled in the last 30 years. That literally means that if I gave birth today, statistically, I would be more likely to die than my mother was 30 years ago. Along the same line, the risk of death for Black and minority women is over 3 times the risk for white women. All this while over 50% of hemorrhages have been shown to be preventable. This is a problem that we could do something about, especially when 40% of hemorrhages that occur are actually classified as low-risk pregnancies. Recent advances to address this include technologies aimed at improving accuracy of blood loss estimation. So for example, Gauss Surgical has a tool that uses computer vision to estimate the amount of blood that's been lost by looking at blood-soaked towels in the delivery room, as you can see here. However, The most commonly used tool today is still just soaking towels in blood and visually estimating this blood loss. What's important about this is that if you're estimating blood loss, it's already too late, motivating the development of a data-driven tool that accurately provides an early assessment of hemorrhage risk. To be more explicit, as a mother comes into the hospital for delivery, the medical team conducts a risk assessment that will divide the patients into high, medium, and low risk categories. And again, like I said before, 40% of hemorrhaging patients are currently being categorized as low risk pregnancies. Simply put, the current tool right here is not good enough. Our solution to this problem will look like this. Upon admission, we will pull each mother's data using our existing Noma Ai platform. Our platform can continuously integrate electronic health records, including labs and patient history, with our novel artificial intelligence algorithms. The output of our algorithm will include continuous real-time risk assessment for hemorrhage, with elevated risk automatically triggering alerts to the medical team, alongside integration into electronic health record risk banner bars like the one adapted here from an existing Cerner system. Our tool will help physicians provide the right level of care to the right patient at the right time. Imagine if we had this tool for the mother I told you about in the beginning. If she had been flagged sooner as a higher risk patient, we could have potentially saved this mother's life. With a tool that aids in clinical workflow, we'll be targeting over the over 3,000 hospitals and birthing centers as our customers. These hospitals are responsible for the over 4 million childbirths that occur annually in the United States, thus defining a large market. The direct costs to hospitals each year total $2 billion, and when adding the larger societal burden, including disabilities to the mother and child, loss of life, the total yearly burden is over $5 billion. The value we're offering here is simple. We will improve medical outcomes by improving resource allocation and clinical preparedness, and thus reducing hospital costs. Our future plan as a software as a service company starts with our collaboration with McGee Women's Hospital to develop a maternal risk prediction algorithm on the data we're collecting now, which could be expedited by any support from the Liftoff competition. After developing and validating with a pilot, we will seek FDA approval. Upon approval, we can proceed with sales and commercialization, providing hospital-based subscriptions, leading to our projected $20 million revenue per year. The Noma Ai team includes members like myself, an expert in blood coagulation and maternal hemorrhage, our CEO, Salim, who has developed and deployed AI solutions over the last 7 years, our Chief Scientific Officer, Milos, with decades of experience in machine learning, and our Chief Medical Officer, Gilles, a medical doctor in critical care. Our specialized team in maternal care includes the Chief of Anesthesiology and a practicing obstetrician at McGee Women's Hospital, as well as a nurse with over 39 years of experience, including her work developing the current maternal hemorrhage protocol algorithm that's used at McGee right now. We regularly meet with our business advisors as well. Please support us in our efforts to revolutionize maternal care. Thank you.
Great, thank you so much. And as a reminder, I know that we've had some new folks join. We are going to have time for questions at the very end of the session, but we're going to go ahead and get through all 4 of the team's pitches and then save the Q&A for the very end. However, if you do have questions for the teams as they are pitching, please feel free to go ahead and post them in the chat, or if you have feedback or comments for the teams, please go ahead and add them in the chat and we'll make sure to communicate those during the Q&A. Great. So our next team is Vesture Mask.
All right, thank you so much, Megan. Hi, my name is Zeev Cohen, and I'm the co-founder of Vesture Mask. When fighting against an invisible enemy, your defense is your most powerful asset. For healthcare workers on the front lines of the fight against COVID-19, their masks are their shields, their primary form of protection, the difference between safety and exposure. Yet this defense is flawed. Due to the limited sizing of common N95 masks, they must be excessively tightened to maintain a proper seal. This causes intense facial discomfort after hours of use. Based on our customer discovery, around 9% of people cannot pass N95 fit testing, and they must resort to inconvenient alternatives such as these PA/PR helmets. Our solution is personalization. The Vesture Mask digital workflow allows for the rapid design and manufacture of custom face masks. These masks fit perfectly to the contour of the user's facial structure, guaranteeing extended user comfort and a reliable seal. Our entire process is non-invasive and is conducted remotely. It starts with our customer downloading our mobile application and using it to take a facial scan. From this facial scan, a 3D model of the customer's face is generated and instantly sent to Vesture Mask. This model is then imported into our physics-based customization workflow. What you're seeing here is an unformed mask seal being formed to the contour of the facial scan. The final geometry of this simulation is then 3D printed from a comfortable silicone material. It is assembled with a standard filter housing, a disposable filter, and a strap assembly. We've been able to test and develop our workflow using different facial structures. These photos show a handful of the first wearable prototypes we've been able to make. In addition to our team, we have made prototypes for important project stakeholders, a bioengineer and the head of 3D printing at UPMC, the Associate Dean for Research at Pitt Swanson School of Engineering, and a doctor at Boston Children's Hospital, all of whom have commended the mask's fit and design. To scale our business, we will first need to focus on the development of our mask design, mobile application, and customization workflow. We will additionally work to receive FDA and NIOSH certifications. To acquire customers, we will market online, develop relationships with early adopters, and partner with hospitals and companies who will offer our product at a discounted rate. Finally, to keep our customers, we will sell unique filter replacements and provide dedicated customer service. The current size of the N95 market is valued at $825 million. And based on our customer discovery, 9% of users cannot pass N95 fit testing, and 7% of N95 users wear them for over 5 hours a day. If we combine these two groups, we get our target market, which we can value at $132 million. Vesture Mask's success is not reliant on the presence of COVID-19. The N95 mask market is projected to increase over 200% in the next 6 years. So by 2026, our potential market size could be worth over $300 million. Our business model is pretty simple. We will sell our customized face masks as the majority of our revenue, and we will keep our customers by selling filter replacements. For manufacturing and materials, we will partner with large additive manufacturing companies. Our internal costs will consist of marketing, paying our employees, professional software licenses, and acquiring FDA and NIOSH certifications. We see immense potential in Vesture Mask's development. In the coming months, we plan to onboard more team members and rigorously develop our product. With large hurdles such as FDA approval, material costs, and software licenses, our lack of funding is our biggest restraint. So why are we the best people to solve this problem? Liz and I met through our involvement in the Pitt Makerspace Entrepreneurship Program, where we both gained skills in product design, fabrication, and business development. Liz's background in programming paired with my experience in CAD and simulations make us the perfect team to bring Vesture Mask to market. Thank you so much, Liftoff, for having us. And if you have any questions about the prototype, I have it right here. Thanks a lot.
Great, thank you so much, Vesture Mask. So with that, we are going to move on to our third team, Zero Decay.
Awesome. Let me get the screen sharing.
Sure.
All right. Hi, I'm Sohail. I'm the co-founder and CEO of Zero Decay. Zero Decay connects brushing and flossing to your dental insurance, similar to how some car insurance company connect how you drive to your car insurance premium. So the problem is dental decay is costly, painful, and preventable. It's the fourth most expensive illness right after cancer, and it's very painful. 1 in 4 adults have untreated decay, but it's very preventable. Just by brushing twice a day rather than once a day, you reduce your risk for dental decay by 45%. And the real reason people don't get cavities treated early is because they can't afford it. Patients cite cost as the #1 reason not to go to the dentist. So our solution is personalized dental insurance premiums based on oral hygiene. So how does this work? First, we measure for how long and how often you're brushing and flossing using a smart toothbrush holder. Then that data is uploaded to the cloud, and we package this data for an insurance company so they can input it into their insurance model. And by understanding disease risk accurately, they can lower dental premiums. So let's take a closer look at the smart toothbrush holder. It holds toothpaste, toothbrushes, either manual or electric, and then floss. And it actually charges an electric toothbrush while it's there. And basically what it's tracking is when is the object removed and when it's replaced. And this data is uploaded to the cloud, so there's never a need to sync. In addition to building the smart toothbrush holder, we made an accompanying app. And the app displays oral hygiene data and gamifies and incentivizes the user to practice great oral care. And we notify people on how much they've saved with Zero Decay within the app. Looking at the dental insurance market as a whole, it's an $81 billion market with 220 million members, and the average premium is $360. There's 3 big players, Delta Dental, MetLife, and Aetna. So our value proposition for dental insurance companies is we transform them from a passive payer of dental benefits to a partner in a person's dental health. First, we're measuring brushing and flossing and determining if the person's healthy. That means a person's going to be healthy because they're having great habits, which will mean they will have less decay and the insurance will have fewer claims to pay out. And as a result, they will have higher profits. And because insurance can afford to lower premiums, and if they lower premiums predicated on the fact the person remains healthy, this will encourage people to practice better habits that we can then measure. Looking at our business model, it's a recurring revenue stream model using data subscription. We use a smart toothbrush holder. That data is uploaded to the Zero Decay cloud. We analyze data and share our analysis to an insurance company so they can input it to their insurance models. And they pay a data subscription fee to get access to our analysis. The beauty of our business model is the device is sold directly to the insurance at cost and is just completely free for the user. So projecting revenues, if we partner with Aetna, who has 14 million members, and assume a 20% adoption rate, which is the same adoption rate we see in the car insurance market for such products, we would have 2.8 million members using Zero Decay. The device will be sold at cost for $10 to the insurance company, and that would generate $28 million in revenue. And our data subscription fee is $20 per member per year, around 5% of premiums. That will generate another $56 million in revenue. Total, we will gross $84 million. So our competition, we're the only one out there that measures brushing, measures flossing, works with any toothbrush, manual or electric, and it's economical and provides insurance benefits. Our direct competitor is Beam Dental that uses a smart toothbrush, and it doesn't measure, however, it doesn't measure flossing, and it only provides insurance benefits to group buyers, and your employer this product isn't available for individual users. Or you could just use a smart toothbrush, which measures brushing, but it doesn't offer you any insurance benefits and doesn't track flossing. And obviously you could use a manual toothbrush, but it's economical. That's the only thing going for it. But it doesn't offer any of the benefits that Zero Decay does. But you could use that same $2 manual toothbrush and put it into Zero Decay, and it would offer you all the benefits that we talked about. So I'm the CEO of Zero Decay. I'm a dental student. Our CTO has dual PhDs in computer science and computer engineering, and we have many other engineers on our team. Our diverse team has technical expertise and industry experience to execute with Zero Decay. So why is Zero Decay important? Well, For the last 50 years, dental health was thought to not play a role in a person's systemic health. But new research conducted over the past decade finds poor dental health is linked to many harmful systemic outcomes. For example, poor cardiovascular health, higher incidence of oral cancer, increased difficulty in managing diabetes, a higher incidence of stroke, and poor pregnancy outcomes like lower birth weights. Dental health is now known to be an integral part of a person's holistic health. So, thank you. It was my pleasure to share how we're creating a world with zero decay. Thank you for your time, and I welcome your feedback.
Great, thank you, Zero Decay. And with that, we are going to move on to our final team who will be pitching today, Lita Health.
Hey everyone, give me one sec. Okay. Hi everyone, my name is Madison Campbell. I am the CEO of Lita Health and we are a survivor company. So our mission at Lita Health is to transform the existing systems around sexual assault. So what does that mean? It means that in 2019, less than 30% of sexual assaults were reported. And that means that over 2.3 million sexual assaults went unreported. You know, my backstory is I am a sexual assault survivor. I was sexually assaulted when I was a junior in college, as 1 in 4 college students are. Now, with my story, I did not move forward with the process. I did not report. However, the process for reporting is so horrible, and let me describe you kind of what an individual has to go through if they would like to report. So the only solution to capture forensic evidence after sexual assault, and our main competitor, was considered new technology in the 70s. It is a combination of pens, papers, takes 4 to 8 hours long. And by the way, during COVID-19, sexual assault survivors have been turned away from hospitals even doing this. But let me give you a little bit of an example of this new technology that we kind of have. So pens, papers, nothing, right? Takes so long, so much process. It's like going to the DMV, but 10 times worse. And you're doing this after an individual has been sexually assaulted, right? That's incredibly crazy. We need a better option. So what we're doing is we're creating the first ever at-home rape kit. So sexual assault survivors, after they've been sexually assaulted, can complete the examination in 15 minutes from the comfort of their own home. This is the first solution built by survivors like myself for survivors. And we believe that it will revolutionize the way that sexual assault is handled in the United States. You know, what we've done is created a hardware and technology solution. On the hardware side, we have a HIPAA compliant platform to add evidence, testimony, document the sexual assault. We've also written instructions using sexual assault nurse examiners who made the experience incredibly easy to use. Anyone can do it. You're only collecting samples from the most probative areas, so from your mouth, vaginal or penile area, anal area, and the underwear you were wearing. And then you have the ability to send it to a laboratory where, with our third-party laboratories, we actually have a turnaround time of 48 hours versus the average government turnaround time of 2 years. And not to mention, is this an incredible problem, but 200,000 kits are backlogged on police evidence shelves as is. This is crazy, and it's something that we definitely need to innovate. You know, like I was saying, right, sexual assault survivors were considered non-essential patients during COVID-19, and this allowed us to actually test it out in California. So in California, we actually work with district attorneys, police, and nurses to use at-home kits. Those have gone in front of a court of law with no chain of custody or admissibility problems, which means that these kits will be able to use in a criminal court setting alongside any other type of evidence, including a hospital kit. You know, we're starting with a kit, but we're really thinking about a holistic solution to this massive, massive silent pandemic. A silent pandemic, which by the way, is only increasing during COVID. Domestic violence and sexual assault has been on the increase. When we looked at the problem in the beginning of COVID, we're looking at a 200% increase. And that's, you know, when colleges go back, when we're kind of out of the stay-at-home order, we really think that there's going to be an increase. So like I said, we're starting with this kit. You know, we have first mover advantage. No one has ever done this. We're expediting the testing, getting that down to 48 hours to get the result back, but also looking at kind of the care that surrounds it. So being able to offer Plan B, being able to do sexual assault testing, but really being able to follow these folks and create a community that they desperately need of mental health care and connecting them with other sexual assault survivors so they never have to feel alone. You know, solving this problem is a multi-billion-dollar industry just with the kits alone. The average sexual assault survivor is costing the system, both the insurer and the government, $130,000 plus in treatment, all the way up to $200,000. You know, we've made headlines with over 1,000 individual mentions in the press. We are quite controversial. What we're trying to do is disrupt the criminal justice system as it is. And so we kind of like to make headlines in doing so. This is my dog, by the way, who also wants to say hi. You know, we've grown to an over 60 plus team with less than a 10,000 monthly burn. That seems like a crazy number, but let me tell you kind of what we're building, right? Not only do you have myself, my co-founder and CTO, who's absolutely amazing, our general counsel who did over 12 years at Merck, amongst regulatory advisors and full stack engineers, but we've also amassed student brand ambassadors at colleges nationwide, not only here in Pittsburgh, you know, to represent what we're doing on college because it is such a big epidemic on college, looking at the 1 in 4 college students and wanting to be there, you know, during our business model to make sure every single college student is getting one of these kits. We're 66% female, we're 49% minority and 50% first generation, but 100% of our team embraces the difference of opinions that we really need to build this company. You know, we have really kind of great experience and we're looking to really change the way the criminal justice system currently works. You know, the last question I like to ask folks is, what side of history do you want to be on? You know, this is the side of history where we want to create more options. We want to give survivors more autonomy. We want to give them more control. We want to empower them. Do you want to be on this side of history, or do you want to be on the side of history where we've agreed that the status quo is good enough, right? What we're doing is good enough. It's not good enough. And what we really, really need to do is completely change history as we know it and make sexual assault a definition in a history book and not something that the statistic is 1 in 4, which is much higher than your lifetime statistic of getting cancer, which is 1 in 6. And so thank you very much. I really appreciate it.
Thank you, Lita Hells. So at this point, we'd like to move into a Q&A for all of our wonderful semifinalist teams who have joined us for today. We've gotten some wonderful feedback in the chat. I see people have been coming in saying great ideas, super interesting ideas, and I'm sure that everybody in the audience joins me in being really impressed with all of these wonderful ideas that have come out from students and recent graduates right here in the Pittsburgh area. So I wanted to go ahead and just kick it off with a general question for our panelists as we wait for some specific questions from the audience to roll in via chat. So for everybody on the call today, I think that one challenge that a lot of young people face who are interested in entrepreneurship is, you know, how do you come up with an idea, and then how do you make sure that that idea is flexible enough to pivot in the case that the initial idea doesn't end up being the exact right fit for the problem that you're trying to solve. So I just wanted to ask everybody a little bit more about your experience coming up with your idea. What was that like? Did you have to pivot? What has that looked like in light of COVID-19 especially? So this question's open to all of our teams today.
I can give some perspective on that. So in Noma Ai, like we kind of started with like Michelle has been working on the problem of maternal hemorrhage for a really long time, and us and our team, we've been working on using machine learning and see where we can improve clinical workflows. Like there's so many areas with improving that machine learning can be used to improve by providing additional insights. And our job has been really to speak with physicians and really validate our understanding and explore places that efficiencies or improvements are possible. And really understand how we can make an impact by providing a tool that can be useful for physicians, for medical teams. And that was really a big part of what we needed to do and we're continuously doing to find out the problems that we can tackle. And really the idea is to try to build better monitoring solutions for the hospitals. Like you have probably heard about alarm fatigue, the problems of too many alerts, the false positives that are mostly annoying physicians and medical teams rather than being helpful. So we think we can really make an impact, and it's a matter of finding the places that needs improvement in healthcare. So that has been for us.
Great, thank you. Did anybody else want to weigh in on that question before we move to the next? Great. I saw we did have a question for Lita Health, and Madison, I saw that you replied to this in the chat, but in case you wanted to reply generally to the entire audience, we had a question that said, with the at-home sexual assault kit, what happens with the chain of evidence in court? So Madison, do you want to take an opportunity just to address it to the wider audience, just in case anybody else had that same question?
Of course. So we get asked that all the time. And I think it's, without getting really muddy into the legal details, chain of custody was created for the government to behave, not private persons. So evidence is routinely, even before we existed, accepted into a court of law that is self-collected. Some self-collected evidence that you might be more familiar with is text messages, videos, right? Those are all self-collected that are routinely admissible in a court of law, alongside bed sheets and things that are brought into a police station. So this evidence is no different than any other evidence. It's just, you know, something that allows the survivor to feel empowered and doesn't make the survivor have to go into a hospital where they might not feel comfortable in that very, very time sensitive point. You know, and I think the interesting thing too is it comes down to setting court precedent. If you would have talked to me earlier this year, before these kits were actually used in a court of law, I could have given you all these, you know, anecdotal kind of resources, but now the kits have been used with no chain of custody or admissibility problems in front of a judge and a jury, and we're super proud about that.
Great. Thank you, Madison, for clarifying that. We've gotten some more great feedback in the chat, just so that everybody else can hear, because I know not everybody on the call can read what's coming in. Stephen says, excellent ideas. Love all of the presentations, especially the ending note by Madison just now about being on the right side of history. So that sounds like it's resonating with folks. And we have a couple other messages coming in saying all of these presentations have been very impressive, wishing the best for all of the teams. We do have one more question that just came in via chat from Kristen. The question is for Noma Ai, and the question is, what is the potential cost savings for hospitals that use Noma Ai?
Actually, can I share screen again on this?
Sure, yeah, you should still have the ability to.
Okay, great. And it is loading. Got it. Okay. So we were also very interested in that, and in terms of also related to one of the questions about pivoting, you know, part of the pivots we've done is like, how could we actually save money, and how can we make this product more useful in saving money? But one of the biggest differences is that hemorrhage complications can increase the cost to over $90,000. And additionally, one of the more direct costs that can happen that can really add up is blood transfusion, where each time you do a blood transfusion, you're looking at around $1,000. But if you knew sooner, there's a device called a cell salvage, which takes like $50, and having that set up, that takes 5 to 10 minutes to set up. But again, with that high flow rate to the uterus, if you had that set up in advance, you could just immediately start using that and then reduce this entire cost of blood transfusion. But additionally, just knowing in advance all the other complications that can happen as well. And then in the beginning, we did mention the cost of transport. So that patient that was at a hospital which was low risk, and then she had to be transported, that cost of transport could have been different or entirely removed if she had gone to had known she was a high risk patient and gone to a more well-equipped hospital to begin with. So that would be how I would describe that. Did that answer your question?
Yes, it looks like it did. Thank you for that explanation. Okay, so we have one more question that just came in via chat. The question is, what barriers are you putting in place to stave off fast follower copycats? I'm guessing this question is addressed to all 4 of the teams. It also asks, how far along on IP are you, or are you planning fast large scale acquisition or other? So basically, what are kind of your plans for expanding in the future? Thank you for that question, Gino.
I can start. So I think for us, for instance, we're the first mover to the market, which is sometimes it's a good thing, sometimes it's a bad thing. You know, for us, there's so much you can do, right? We have patents, we have, you know, IP protection there. At the same time, right, if somebody wants to, you know, kind of enter the space, they can, right? IP only does so much. You know, for us, it's really about creating a brand. It's a brand that people know and trust, and that is incredibly reliable, that puts customer service first. You know, that is something that I think you have to kind of create that moat, right? The moat where folks that are your early adopters are not going to want to go to a fast follower copycat because you've provided such an excellent service. And then for me, at least on IP, you know, we filed 9 patents, we're filing more, which are great, you know, kind of expanding our technology, and also allows us a way to license our technology in the future to big pharmaceutical companies, or even use them for different other non-forensics specialties. And planning fast, large-scale acquisition. I think for us at least, you know, and I don't know if this question is like, what is our end strategy? So our exit strategy, I think there's an exit strategy for maybe all of us on the company, right, of an acqui-hire type of position. You know, so looking for the right person that can kind of take what any of us are doing and kind of put it up, give us more resources, allow us to expand rapidly. But also I think that there's, you know, a great thing of being so great that you're acquiring any other companies that are ancillary companies that will allow us to do work better and that are in our market. At least that's kind of my opinion.
So for us, on the side of how far along are we on the IP, we actually have a platform for deploying machine learning and predictive models in real time in the hospitals that we have been developing for the last 5 years, and we already have licensed it from and took it out of the University of Pittsburgh. We have used that platform to deploy models in past inside hospitals, inside 2 hospitals for different projects. Right now, our platform is being used to help with tracking of the COVID-19 patients in a few different hospitals. So we actually have a software for deploying these things within the hospital systems. And a great barrier beside IPs that you can create is actually the experience on manipulating and using medical data. Like hospitals data, it's very complicated, noisy, and it's very inconsistent. And being able to effectively use that itself in real time, it's actually a hard task. We tackled this for the first time for real time 6 years ago, and we soon realized it's going to take way more than we expected. And it took 5 years for us to be able to deploy our models. But now we have that technology, and that itself is a very complicated barrier to really enter this area without having access to first large data, but also people who have that experience. And our team has more than 70 years of experience in the area, which really enables us to be able to expand. Now maternal hemorrhage with like experience of Michelle, who's really expert in the area, is our first focus, but we're already speaking to other hospital systems and to physicians and see where we can expand to and bring new monitoring and alerting solutions where it can make an impact. And one of those areas is in emergency department, where the decisions of where to admit a patient to or discharge the patient safely, it's a great problem. Like you probably heard about stories within COVID-19 patients being discharged because they're young, but they're coming back to the hospital within 3 years, but they're not reaching the door of the emergency department, passing out in the car in front of the hospital. That's crazy. And if you can really take advantage of data, create these predictive models that in real time they can monitor complex and high dimensional data of patients, and provide additional insights about patients' informations and their outcomes to physicians and help them with the clinical decision making. That's what we can try to do, and we think we can make impact in various areas of healthcare. And right now, our platform can process more than 20,000 different types of information about the patient in real time as they become available, and feed them to these predictive models. And that itself is it took us many years to get here, and that itself is a barrier for it.
And for us, it's the barriers we're putting up is the data that we're collecting, similar to Noma Ai, is our moat. The data of oral hygiene and taking that and translating it to something that the insurance can use is very difficult. And we're trying to develop this process, this algorithm, this machine learning and AI that can actually take just brushing and flossing data and then predict, oh, this person's going to have decay and they'll need more dental care. And moreover, we're really trying and focusing on building a brand for great dental health, because I'm a dental student, and honestly, it was not until I got into dental school that I learned I was brushing my teeth completely wrong. Like, that's crazy. Like, so I think there's still a market out there for patient education, and then that's really, I think, where we can target and expand. And in terms of getting acqui-hires and stuff, I'm really focused on leaving a legacy. I think this is the biggest issue in dentistry right now, is the lack of access to care. I see it every single day as a dental student. Patients are choosing between, oh, should I get a filling, or how am I supposed to afford that? How am I supposed to afford a crown? And I don't feel that that's a decision any patient should have to make. The idea that you have to settle for something less because you're unable to afford something. And that was really disturbing to me. And that's why I started Zero Decay, to solve this issue of access.
Thank you. Any other thoughts on that question before we move on to the next? Okay, so we had a question come in specifically for Lita Health. The question is, how are the kits going to be distributed? Would they be available for pickup right away or somewhere, or would a person have to order them online and wait for them to be delivered?
Yeah, so we don't want anyone to ever have to wait online to be delivered. So we're not going to be a traditional company, like a traditional D2C company with like a Shopify website or Amazon. Because that DNA is degrading off of your body incredibly quickly, it needs to be there in a few hours versus a few days. So we're attacking this in a few different ways. So one, primarily our go-to-market is B2B2C. So what we're doing is going to universities, selling these. By the way, any channel partners that anyone knows, that would be incredibly beneficial to us. And actually giving these out to students. So every single student is getting those, both men and women. So they have it already in their dorm room. And it's also creating a psychological deterrent. I know that you know that he knows that every single person has one of these. Although we believe reporting will go up initially, we believe incidents over time will go down. And trying to do that on a multitude of different channels. So not only universities, but also corporations, military, even clinics, right? Things like that. But during COVID, we've seen this influx of folks saying, why is this not in a pharmacy? This should be in a pharmacy. So we're trying to work on that as well. Our closest way into getting into a pharmacy, if anybody knows Giant Eagle, let me know. But we've actually partnered with a direct-to-consumer pharmacy delivery company. So you'll be able to text a number. As some of you probably know, during COVID, you can now get your pharmaceuticals delivered to your door, and it will kind of be that online pharmacy experience while using that logistics carrier. And you know, there's definitely opportunity, I think, in the future to use Postmates, Uber, Seamless, something like that, something that has last mile shipping capabilities. But definitely a pharmacy is kind of our end goal. This should be, you know, right next to Plan B, tampons, anything like that, even, you know, condoms, right? Like kind of in that aisle where anything you need sexual health related, it's right there, and you have the ability to get it.
Great, thank you, Madison. Okay, so one more question in the chat. This question is for all of the teams. Are there any barriers related to policy at either a federal or a state level that you're currently encountering or foresee restricting how you can push your work forward? So this is open to anybody who would like to answer.
Yeah, I can speak on this. So, I mean, our biggest restraint in terms of getting our mask to market is NIOSH and FDA certifications. So this means just like rigorously testing all of the mask prototypes we make, and we've learned how to do the same kinds of mask testing in-house as they do for these tests. So we've been able to test our prototypes as they're made to make sure they can pass these, and then also getting actual in-person tests with FDA certification. So that's one of our main ways, and then that's our main way for getting past this barrier.
For us, there actually isn't a barrier. It's more like there's an opportunity. So we talked to some dental insurance companies, and what they're saying is for like public dental health plans, they have to report usage outcomes because that's the only thing they can measure. They don't know whether your cavities are going up or not. They can just measure the codes that's getting validated. So if there was a way to say like, look, this person went from not brushing their teeth to not brushing and flossing twice a day, that's a huge thing that an insurance provider can say, hey, look, government, we're doing a great job. Besides getting usage data, we also can measure and provide you people's oral care data, which is really valuable.
Great. So I have a question I'd like to end on, and if anybody has any last minute questions, make sure to get them in ASAP. But I just wanted to ask generally, what have some of your biggest challenges been? And do you have any specific ways that you think the Pittsburgh life science or entrepreneurship community could be better supporting you? Because that is one of the goals of Liftoff PGH, the summit as a whole, is better supporting entrepreneurs, specifically in the healthcare and life science space right here in Pittsburgh. So I'd like to open that up to everybody to see what have your biggest challenges been, how can Pittsburgh better support you? And then while we're wrapping up with that question, I'd also like to encourage all of our teams to post their contact information or website information in chat if you'd like to. That way, any of the attendees who would like to follow up on a one-on-one basis with any of the teams can do so. So that's, but the question is open to all of our teams.
I think one of the biggest challenges, and I hope I'm speaking for everyone too, is always funding, right? It's been very difficult during COVID, to get funding, to find the right folks that are going to be behind, innovation in the health sector. So I think hopefully for everyone, if anyone has capital introductions and is interested in any of the companies here, that would probably be great. And I think for me personally, it's channel partners, right? Finding the right channel partners that are interested in talking about this, interested in putting this on their campus. I think University of Pittsburgh, CMU, we have good communication with the students, but not administrators. That would be really great from my end, or even insurance companies too in Pittsburgh, UPMC.
Our biggest challenge has been materials and manufacturing selection. So we've been able to prototype with smaller scale printers with skin safe materials, but we're in search for like a larger partnership with additive manufacturing companies that print out of flexibles and skin safe materials. So that's what we're really on the hunt for. So if anybody has connections or has ideas for us, I would love to hear from you.
And I would just say, in terms of the support that we could get, we are looking and have had some barriers into looking at other healthcare systems, right? So we have really good partners at McGee. We're expanding, to Allegheny Health Network, and I think it's been a barrier to entry, or I guess expansion, trying to get to those other healthcare systems. So if anyone has suggestions about that, and I'm sure that at some point we will also be hitting some FDA hurdles, although I think we are a little bit more worried about like adoption and making sure that what we're making works in a way that makes sense for each individual hospital. So I think if you have a solution that works, yeah, that's the most important part. So.
For Zero Decay, it's trying to find small batch manufacturing. Small batch manufacturing is very difficult locally. There's multiple like small batch manufacturers like outsourced, like out of the country, which is fine, but we would love to partner with a local small batch manufacturer and be able to iterate on a much faster, shorter scale and really get that process moving. Hardware is really difficult to do, so yeah, and then always we're continuing to look for people in the insurance sector, talking to them, getting them interested, and then finding our right channel that we want to adopt.
Great. Well, I would like to thank all of our semifinalist teams one more time for joining us today: Noma Ai, Vesture Mask, Zero Decay, and Lita Health. Thank you all for joining us. This was a really great session. I hope it provided some inspiration to everybody in the audience to see what great ideas we have in the healthcare innovation space right here in Pittsburgh, coming from some really incredible, motivated, driven young folks. So thank you again, everybody, for joining us today.